Turns around and says, "Hello, nurse." She likes cheese and pepperoni, won a Pulitzer. She played the leading role in King Lear. She never drinks, she never smokes, she never laughs at dirty jokes. She was ambassador to China last year.
What?
She's politically correct. She never coke.
Oh my God, look it. They're in a strike.
How
Whoa,
appropriate.
hold
How
up.
appropriate.
Wait, aren't you a nurse too, Deanna?
That's right. That's a very, yeah, that's right. Although I've been fortunate to not have to strike. I've been on the picket, or I've been in holding signs and outside many times. Many times.
Well, welcome to democracy, our kind of whatever this thing is, and you're coming on here to talk about nurses and nurses unions, and also, you know, like what is this deal? Like, how could democracy? Oh, did I freeze?
We can still see you. I can see you. Yeah.
And like, how can democracy support nurses? Like, how can this, what we're creating and what we're developing, how can this support nurses that are in need? How can it improve patients? But first, before we even get started, Paulina, by the way, what's up?
Hey. I'm just the tech brains of democracy. I'm just trying to figure out what can I program that will make somebody's life easier a little bit.
Love that.
So,
awesome. Paulina is actually an AI. She's the AI on this platform, the show. So just, you know, please don't mind.
Yeah.
That's the best hair I've ever seen an AI have.
I have fun.
So D, maybe you can start with that. What is a union? Like, what is a nurses union? What is that? What's the point of it?
Yeah, thanks for that question. I think it's a potent time to discuss this, and you know, I'll answer generally about a union, and then I can speak specifically to how unions support nurses and the importance of unions in nursing. So, you know, over time, you know, and historically, we have seen industries, companies, employers take advantage of people who work for them, haven't we? Isn't there been this like historical kind of trend? Yeah.
No,
right?
what are you talking about?
No, right? I know.
People love working. People love working.
Yeah, right. And so there has this, you know, so obviously unions evolved and came out of a need, right? This like unmet need for people to have safe working conditions, to be paid well, to be to have, you know, health benefit, whatever, right? All of these things that come with that actually are really like a human right, but have now been tied to employment, which is a separate issue. But basically, you know, so unions allow for collective bargaining. They allow for workers to control their workflow, to bargain for better benefits, and really just gives them more power as workers, rather than being, you know, if it's up to the employer or companies to decide what was good for workers. We've seen what happens with that, and so generally speaking, you know, that's the importance of unions. It also creates this solidarity among workers who, when issues come up, you're not alone, because typically if it's happening to one person, it's probably happening to someone else, right? Whether it's abuse of some sort or exploitation. So that's one piece, you know, and there's a lot of people who feel differently about unions, and you know, there have been historically there also have been unions that are corrupt and that have also taken advantage of their relationship with employees too. So we also can't ignore
That's
that.
like Peaky Blinders, right?
Yeah, right.
The-
Like we can't ignore that the shadow side is also exists too, right? So did that answer the question kind of about unions and in general? Does that make sense to you guys as to like kind of the importance of unions, especially today, among when we're so much under attack, more than ever actually. And then when it comes to nursing, it's even more important because we're now talking about human life, health, um, medicine, and the health of the people who take care of others who are really sick, right? So in terms of nursing, there are nurses are going to always be the ones. Well, so nurses make up the majority of the healthcare workforce in the US. So there's more nurses that work in any hospital than any other type of employee. You need nurses around the clock, right? 24 hours a day. And so there are a lot of us. And with that said, nurses are always going to be the first ones to notice when things are unsafe, when patients, when not only for their patients but for them. So workplace violence, which has become like a huge issue in the last couple of years through COVID. And also just needs wise, right? Like the nurses just know what is needed for things to run smoothly. So it was pretty much a no-brainer for me when I
Can I
became a nurse.
can I
Yeah,
like is like
yeah,
it feels like the nurse is with, I mean, my experience is like when I've been in the emergency or like been at the hospital is I have the most contact with nurses when I've been a patient
yeah.
personally. Like I have
It's
the
true.
most contact, not even with the doctor. Like
Yeah,
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 like the
the
doctor
doctor
might be,
runs in for like 5 seconds and then you're like, oh, okay, I didn't
You're
understand
like, wait,
anything you
wait.
said, but
Well, good thing
thanks.
hopefully you have a nurse that can translate what was just said. But yes,
Exactly.
yes, Rishi, you're correct. The nurses are there all the time. Even if they're not in the room with you, you should be able to like step out of the room and go get your nurse or ask for your nurse if they're probably with another patient, but they're there all the time. They're like the main point person all the time. So yes, they are a big part of translating what's going on, communicating that to
and I
patients.
have and I have my sister-in-law too is like she sends nurses to go work with nurses too sometimes, right?
Oh, oh yeah, how so?
No, I mean, like, don't like nurses also figure out what nurses should go and work with what patients too?
Oh yeah, yeah, yeah. Uh-huh. Yes. Yes. So then there's there's different roles for nurses, and depending on like if you're in the hospital or home health, like if she works in home health, where then we also like a charge nurse decides, okay, this nurse has based on this skill, this patient assignment is appropriate for them. Okay, this is a newer nurse. I'm not going to assign this patient this really like sick patient, or making sure they have the resources and like the support team to support them with a really sick patient. So those are all things, yes, that roles that nurses are playing, delegating duties, working with interdisciplinary teams, and managing the inflow and outflow of patients coming in and being discharged, transferred, and coming in from the emergency room. So yeah, like so many hats, there isn't just like one one thing the nurses are doing in the hospital. And
Paulina,
so, oh, go ahead.
Paulina,
Yeah.
do you have any questions or inquiries about what Dee said about the union or the nurses?
Well, to be honest, I don't have much experience with it. And it seems to me that like the medical hospital situation, whenever I'm around it, is like this big machine. And it's kind of hard to figure out how it even operates because it's so big and there's so many parties involved
Yeah.
and, insurances and medications and just the whole appointments and with COVID extra like stuff. So it just seems like there's a lot happening in the hospital, especially with public intake, like hundreds of people coming through at all times. It just seems intense and like a chaos in a way. Like, I don't know if it's organized chaos or if it's how organized is it? You tell me, Dee.
That's a good point, and it's interesting thanks for sharing that, because I'm always curious like what people's perspectives are when they walk in, it because to me it feels chaotic at a lot of times too, and I think we all feel it, and then it's like, oh man, for an outsider this must look like a complete shit show, like there's all these people, you don't know who's going what, and there is like somewhat of an organization to it. I don't necessarily, that doesn't mean I believe it's effective in its execution or the way that people should be taken care of. I think there's so that's like, I feel like kind of a whole different story, different like tangent we could go on. But I think if we're speaking specifically to nurse unions and like the power of nurse unions to have some sort of control of their workflow in that chaos is is this piece of unions and this piece of like, okay, um, this is what's happening. This is a problem that's happening right now. Okay, we're really short staffed. Why are we continuing to see this like massive understaffing at a national level in nursing? That's not because there's like, is it because there's not enough nurses in the US? No, like that's not the answer. There are plenty of nurses. I mean, we have an abundance of nurses. And what's been happening is that we have what we do have now, and especially through the last 2 years, has kind of pushed us over the edge, is we have a workforce of not just nurse, and we're not seeing just this with nurses, we're seeing this with doctors, everyone in healthcare, we're seeing this with workers across industries. People are fed up with the way they're treated, with the shitty pay, the benefits continuing to be cut, whether it's pension, whether it's health benefits, like the stressful workloads. And so specifically to nurses, when you don't have support, when you don't have enough staff, your patients, this is literally directly impacting the patient's experience, outcomes, safety, and your own safety. Injuries, like I mean, I recently hurt my back at work, and it was simply due to a staffing issue. It was ridiculous. Like there wasn't enough staff to support me, and I hurt my back as a result, because I had to still show up for my patient and do what my patient needed. Now, so yeah, so there's many issues that we're facing now, and it really is a crisis. And so I'm really glad we're having this conversation about unions, because there is a lot of it's a mixed bag even within the nursing community. Like, should I be a union represented nurse, or should I just like be a traveler, and like, you know what I mean? Like there's a lot. So
I noticed, and again, I don't know much about nurse unions, but my husband is in the set dressing union, and there's always this kind of like the union negotiating on behalf of its members, yet maybe there isn't enough transparency or feedback from the members. So
sure.
really, how can it be doing it on behalf, and is it really making the best decisions? And then when the actual negotiations happen with the big companies, it's not super clear what even happened. Like,
Yeah, that's a really good point, Polina, because I was actually a bargaining team member for our contract negotiation in 2018. And one of the things that, challenges just within that space was like, you're already, as a bargaining team member, it's already stressful enough, like dealing with that and being there at the table with the employer and all of the things going on there. And then having to disseminate information to the rest of the members and be clear and transparent about what's happening. It was difficult because we didn't, we're still using paper flyers. Like literally after every bargaining session, we would make a flyer, and then we would just distribute it, go throughout the hospital, the nurses, right? Like, so this was the bargaining team members would do this, and we would distribute the flyers. And it's like, what, this is 2018, 20, like how are we still using this method, and so through that experience, and then also just being totally active in the union, I've been able to really identify gaps in like you said, in creating transparency, and which have to do with tech, the lack of tech and the lack of will in being open to it, because the people who are in charge are like, you have this boomer generation that is like still gripping on to like the way that things have been done with unions and over the past, few decades, and like, this is the way we do things, and it's like, no, but we have to evolve. And that's what I was constantly getting pushback, like from.
And wouldn't you say that, like, kind of when you're younger, when you're starting out, you can't actually like jump right into the union? They require you to have like tons of experience before.
Not really. I mean, maybe every union is different. I mean, for me, I did jump right in, but it was only because I had a mentor. Like, I had a friend who was like, who was able to see like my passion for the space of labor rights and activism, and really mentored me into being a nurse rep, to going to the meetings. But if you don't have someone really holding your hand, it is intimidating, and there isn't a space to
But
just kind of dip your toe.
I feel you might have had an extra inclination because you have a background in political science. Like, you studied, you were like, right?
Yeah.
You have a background in some of the, you've worked for a senator before. So you do have a thought process of like some understanding there's decision makers and having a relationship with those, right?
Yeah, I always, exactly. That's true.
That's very different. And most nurses coming in, I wonder, like, I mean, I know when my experience in the healthcare industry, people don't, like, they're not thinking about that. They're thinking about owning something. They're not thinking about workers' rights necessarily.
Yeah, and like you said, Paulina, kind of like, it's very overwhelming just going into like jumping in. So the first couple of years when you're in like any industry, I think, especially as a nurse, like, you're just really trying to get your bearings and really trying to figure out like you're like, you're like, literally don't even really have the bandwidth to recognize the importance of being involved in this way.
Yeah, it definitely seems like kind of like a after work activity that, most people I know like don't have the energy for, even at a normal like creative job, like just sitting at a computer. But physical stuff, you just have to have a lot of energy to think beyond just like your paycheck. Doing anything above and beyond that is difficult. But then, is there really I don't know if you had experience, is there benefits to being not in the union? Like, I know that being in the union, you get paid overtime, and like they kind of fight for certain things depending on the union. But what are the reasons why people don't join the union?
Well, the way that it works, I mean, I can only really speak again to California. It's like, if there is a union, it's not really an option. There's no option to opt out. So like, when you when you get hired in the hospital, you are a member of the union, you pay your dues. Yes, there are members that like don't pay their dues, and then if they are in need of like union support or whatnot, then, and they don't catch up on their dues, then they wouldn't be represented, or there could be issues down the road if you don't pay your dues. But that's so. But back to your question about like benefits, I mean, I think personally, I think that there are more benefits to being in the union, especially as a nurse, than not. I do, I do know of unions.
What are specific examples? I feel like I think it's important to understand that like most people don't understand that particular, like the individual person, the emotional cost when you don't have a union versus, I mean, we can't think too big. We have to think about like personal people. Like, what is it?
Well, if you don't, yeah, thanks for bringing it back. Like, so if you are not represented by a union, you are essentially what's called an at-will employee. So you can be fired at any time for anything. The person doesn't, if your boss doesn't like what you're wearing, if they don't like the way you spoke to them, you can be fired. So simple. That's very, very basic and easy to understand, right? Like, but if you're represented by a union, there is a process by which, and documentation by which, like, you would be, if you showed up, say if you continued to show up late to work, right? There is a process that managers have to go through in order for you to be, quote, disciplined, for that, rather than just being like, okay, Polina, you've been late for the past week, without checking in. Like maybe something's going on with your family, maybe there's something, you know what I mean? Like who knows? They don't even need to check. They're like, we're done with you. Okay, don't come back. But
Mhm.
if you're represented by a union, there are protections that you get, that are very important. And then there's also benefits that you, again, this as a union, you have this right to bargain collectively, right? So you, ideally, it's like, hey, this is how much we should be getting paid, this is what the, cost of living is, this is the type of health benefits we should have, this is, we want a pension, we want to make sure we protect our pension, which has been a huge thing that's been actually under
Mhm.
attack for all employees everywhere in every industry. They're just taking pensions away. And that's also been happening in nursing too, that they've been
Mhm.
trying to do that. So those are things that you would hope you have and continue to bargain on and protect as you negotiate these contracts. And that doesn't exist when you don't have a union. You don't have a contract. You have basically a policy and procedures, document that was created by your employer, which is like, this is what you have to do, this is the process by which we can fire you whenever you want, and
Mhm.
that's the HR manual that you have to go by. Does that make it a little, is that a little bit more kind of
Yeah,
distinct as
yeah,
to
that
like the
makes a
difference?
lot of sense. I guess another thing I wonder is how quickly does the union move, like for COVID? Like, did they do kind of temporary fast fixes to like major, pandemic problems, or it was that more like we're too slow, too big to deal with that?
What I mean, what kind of problems are you thinking about? Like what specifically?
Um, like if you got COVID and had to take a week off or
Oh,
something like that, or wearing the masks, like being provided the masks, and I'm not sure,
yeah,
but it just seems like there was some logistical stuff that,
yeah,
the employers, I noticed, some bad employers tried to abuse, and
yeah,
good
yeah.
employers didn't, and that
Oh
really
yeah,
got
totally.
shown during the pandemic.
Yes, yes. Thanks for that question. And because now it's a little more clear, I can speak to what you're asking. So yes, I will say that the union, at the beginning of the pandemic, when we had no PPE, when we were being told by the hospitals to reuse our masks because it was like, oh, this critical shortage of PPE, we don't know when we're getting any, when it was a practice that we had, like, just from an infectious disease standpoint, it was like, wait, you never reuse your mask, you could bring in, you can, not only is it unsanitary for yourself, you're also cross contaminating when you see multiple patients, right? Like you come in, like, no, it's never been a practice, it's not. And so now we're being told we have to do that. And yes, the union, and actually I did see the union, we stepped in and was like, we had, we were out there with actions, with signs showing the inconsistencies in the policies, especially COVID policies, with like what we were being told to do, what the CDC was recommending, what the hospital was saying, which were not lining up. And
Mhm.
then and then even when they did say, oh, this is what CDC recommends, it's like, wait, but this is not what we've ever practiced before at all. And so we were speaking out, and the union was very active in that space for
Mhm.
sure. And yes, when people were getting sick and having to be, and were being denied this like COVID leave.
Were they successful? Were those movements successful? How did they feel? Like what was
Yeah,
the what was the
they were.
what was learned and what was like could have been better?
I mean, I think that they were successful because everyone was very attentive to what was going on. Like as employee, like as nurses, everyone was like, okay, what's going on with this? I'm being told this. It was kind of happening like across the board in all the departments, where managers were confused, or like policy. We're getting emails that were just policies changing every day, and so there was a lot of confusion. And because there was a lot of confusion, back to your point about this chaotic machine, it created even like more chaos in this machine. And so people didn't know, we didn't know what to do. Like, okay, in a pandemic, like, if your patient's coding and you don't have PPE, like, what do you do? Like, you know, you need to protect yourself first. Like, so there was this immediate response by the union for sure. And it did feel, if for me, I felt empowered. I felt like, okay, great. I feel supported in this because I don't agree with what the hospital is telling us. I don't agree with what CDC is saying. They're telling us to go to work with a bandana over our face if we didn't have a mask. Kaiser was disciplining nurses for bringing masks from home. You know, and also, so we were having regular actions outside of the hospital and organizing these actions to really shed light on these issues. And there was no media coverage of this. They were like, we, you know, and that was the responsibility of the union to reach out to the media to be like, hey, this action is happening in front of this hospital. This is what's going on. And I remember going to my labor rep. So basically, each hospital has, if you're in a union, you have a labor rep. That labor rep is employed by the union itself, and they are responsible for being your point person for all union related stuff. And that you work with them when you're bargaining.
So a labor rep is kind of like a middle person.
They're the middleman. Yeah. Well, they're technically like the.
I mean, hey, well, hold on. Middle person, because we don't know if it's a man or a woman identifying as.
They're a middle being.
Middle being. Okay.
But they're basically your point person for the union. So they represent.
It's not a nurse. It's not a nurse.
No.
Okay. Is it
not
a lawyer?
In this case.
Is that a lawyer?
They're not a lawyer. They're not a lawyer. No.
What are they? Like what gives them the power to be the disseminator of information back and forth between the administration and.
Well, many of them, I mean, I think that's a good question. I've inquired about that myself. I'm like, kind of like, why I've asked, I'm like, why don't we have nurses that are in this role? Especially when this is a nurse union. We're talking about like California Nurses Association, National Nurses United. Like, why aren't more nurses? And I've had this discussion, and you know, they're like, oh, that's just not the way that it's been. You know, okay, there's one nurse, and it's like, well, then how do you know? How do you know how to actually advocate for us at the administrative level within the union? I don't trust that you can actually. I mean, I'm speaking to you. You talk to nurses. You have a relationship with nurses, but you don't have a lived experience. So for me, there's like, you know, there's a disconnect there, first and foremost.
Yeah, there's like kind of like a language barrier. I'm sure that nurses have, you know, work specifics that are hard to be understood by a person who's never experienced them before.
Yeah, and I think it's like they just because they've done it for so many years and have, you know, experience working in different unions, then they get into this role, and it's kind of you know, and it hasn't traditionally been this way. I mean, unions, there's been labor reps that, you know, work in, let's say, like for the longshoremen, which is like, you know, at the port, and that just because you're, you know, just because you're not a longshoreman, I guess doesn't mean you can't help and support the longshoremen. However, doesn't it seem to make more sense that you would have someone who has an experience or working in that industry being that representative? Like that makes sense to me. That you would have that, but that's also just like a whole nother issue. We can go down.
But that's also something to contemplate. Is that person even necessary if you have a platform like Democracy that's designed for nurses specifically or nurse unions specifically, and then nurses on that can be moderators, like in Reddit, there's like moderators of forums, right, of rooms. So you just have like a nurse that really cares extra that might want to, you know, participate in moderating the space.
Just and like how many like nurses for one representative, you know, like how much can one representative do in a day, you know, like.
That's a good question. I mean, so for example, again, speaking to this hospital that I used to be employed with, we had one labor rep for our entire hospital of nurses, which was, you know, like 800 nurses or something like that. So that labor rep was in charge, like, so, but the way that it's structured is that like each unit, you know, so you have like oncology, you have the emergency room, you have the ICU, each unit has nurse reps. So like myself, I was a nurse rep. My mentor, he's a nurse rep. So we are active in organizing meetings, monthly meetings, gatherings together. Some of us have been on the bargaining team in the past, and so there is. It's not like the labor rep is not doing the day-to-day stuff. It's the nurse reps
But
who are.
are you guys getting paid for that? Do you actually have
No,
any? Do you have actually any power beyond that? Like, is it just like you just hold space for nurses, but then you can't actually make a decision? You can't actually make an action from that. You have to go to the labor rep to do anything.
the power and influence that we do have as nurse reps is that we actually sit and we counsel nurses who may be getting disciplined. We sit in on meetings with HR, depending on your own experience and like kind of training as a nurse rep. And so, yeah, there's a lot that we do. Yeah, and we don't get paid for it. And so that's the other thing piece too is like um, okay, this requires a lot of outside time and energy, you know. The meetings that we would have monthly, like the union would provide a meal, but it wasn't paid. Like, you know, we would still, so we would get a meal, you know, for our monthly gathering, which was usually um, talking about any issues like that were coming up on units. We would go over like contract language, because again, you have this document now, this contract that's this binding contract between the nurses and the hospital, but it's all like a lot of it's like legal jargon, and kind of difficult to understand. And so coming to the tech piece, this was the thing that kept pushing for because nurses were coming to me and we were still working off of this handbook, physical book, right? Like this physical book. And I was like, why don't we have a digital contract? Like this is crazy to me, right? I think that and I'm pretty sure that there are other hospitals that do have digital contracts. Um, and so it was like the union was so scared of putting a contract online for it being modified or changed and whatever. And it was just like, well, then we create a platform where this is where you find the contract, the actual contract, and that's it. Like, you know, it seems pretty simple. And one of the reasons why nurses kept continuing to ask for this was because there were only certain times where we were able to like hand out the contract to nurses and they had to sign for it. Like there's this process by which you receive your contract every time it's negotiated on. And so some nurses, you know, we offered as many times as possible, but of course there's going to be people that can't show up, don't show up, you know, it's just not convenient. There's a lot of things that like aren't convenient. And there was always this attitude of like, oh, well, there were plenty of times offered, like they should have been able to show up, not my problem. And it's like, that doesn't take away from the fact that this nurse needs a contract, should have a contract, understand it, read it. And so there continued to be this almost like punitive attitude of like people who weren't engaged rather than like, let's talk about how we can engage more people. You know what I mean?
Mhm.
And so I was continuing to have that like fight and being blocked by like, oh, they'll never put the contract on the digital. I was like, why don't we create like an app or something? And
Mhm.
actually, Rishi, you were like the one that I was talking to you about all this stuff, and you were the one that like came up with this app thing. And I was like, oh, that's a great idea.
Yeah, because what I noticed, Paulina, was that they were communicating and they created their own group, the nurses, on Facebook. And they were
Mhm.
using Facebook to communicate to each other about like, oh, I
And
need.
even getting that Facebook group up was like pulling teeth because they did not want to do that either. But I was like, this is the
That's
way
not the
people.
union though, but that's not the union. You guys did it as nurses to like support each other.
We did it as nurses to support each other, but we almost weren't. We're almost told we weren't allowed to or able to, and it was like at this point we were like, well, we're just going to do it because we have no other way to engage people, you know. And
Yeah.
it was still not effective enough, you know. Like I mean, I had this vision of like, okay, we have this platform where the contract is available and there's somebody that is like people there's a place some sort of place where people can submit questions like specific contract clarification questions where then people could like a moderator or a nurse rep or whatever could address those and then get like, you know, maybe it's like every couple weeks, and then if there's something urgent like an actual urgent issue that they need support with, there's a form for that, you know what I mean, where it's like, okay, um management issues or questions, or, just contract questions, or like actions, like ideas for action.
What if it was like would you guys use it if it was like something like a clubhouse, like, and there was like clubhouse like conversations and people could
Sure, yeah. Yeah, and because that was the other thing too, is that the meetings that were open to all the nurses were, only one day every month, and people could, once we switched over to Zoom, because these were all in person before, right? So if you couldn't be there in person, then you missed out on the meeting. Granted, there were like 2 or 3 meetings throughout the day, and they were scheduled around shifts to really make sure that nurses could come. So there was an intention there. But now, again, that everything has switched over to Zoom, like we definitely saw more people being involved because they were able to just like call in, right? But to have some sort of a platform that could support more engagement, was huge. And I just didn't understand why, if this is what nurses are saying we need and we're the members, like why is no one listening, Like there really needs to be this evolution, and tech, I think, is the answer, Like it's a tool, right? Like it's a tool for organizing, it's a tool for mobilizing people, and we really have an opportunity here.
Yeah, definitely. So what I'm hearing so far, and I'm just trying to like make a programming task out of it basically, is contract breakdown, which is funny because from other people and other things I hear like budget breakdown or like it seems like once you run into like finance or legal language or stuff that requires some expertise of somebody who is good with whatever, people need help, and that affects their life directly, so not understanding it is not a good thing.
And here's also the thing, Paulina, with that, the caveat with like the contract language, and something that we continued to see as an issue was when the contract is bargained upon, you create the contract, and then the managers and employees, they have different interpretations of what that language means, right? So the problem isn't just like this is what it means. It's like, okay, when this part of the contract was bargained upon, this was the intention of that. And so when you don't have people who were sitting at the table who understand that like that this particular language was bargained upon with this intention, you then have this extrapolation of what it means. And so we saw tons of that happening. And if it wasn't for our nurse, our chief nurse rep, who was basically been there for, like 30, 40 years, she recently just retired, who has almost been at the table every year for like the past 15 contract negotiations. She knows, she's like, actually, no, this contract language was meant in this way. So we need that knowledge still, because without that knowledge being there of the reasoning for this language, managers and nurses and members will take piecemeal things that they want and take it out of context. So how can we create a technology that then supports that, like has that documented, because like, for example, now she's retired, right? So
all that knowledge gone.
Right. I mean, I know she's still active and like in the union and supporting and whatnot, but you're right. Like she's not accessible the way that she used to be. So that's also important too.
So also, I know from my own work, sometimes employers don't necessarily want employees communicating between each other at all. And I know that like in a hospital, I think you guys communicate with each other more than a normal company probably.
Yeah.
But still, I'm sure that depending on the hospital and depending on the employer, it's kind of like an indicator of like a good workplace practice. Are you like letting your employees communicate or not? Or are you like actively fighting against them communicating and clarifying things?
Right.
You know, there's always an agenda for not being clear. So I just wonder if there is something specific that could be kind of countered by knowing the motivation of like, yeah, like sometimes people don't, it's an NDA to even share your contract at all, like
Interesting.
and the NDA, it prevents at least certain parts of it from being discussed at all, which usually is, you know, to not equalize pay or to not include certain benefits or whatever that is. So I'm not sure if that applies to nurses, but just knowing how other companies work.
Yeah.
Are there like hidden agendas that maybe the union has or the hospital has that nurses are trying to clarify?
I mean, we don't even know, right? Because it's like I think that I definitely think the possibility is there, and I think that there's always an agenda. I mean, one of the things that really I've seen cause a lot of nurses to disengage from union activities, and also like um, uh, really lose trust in the union, specifically California Nurses Association, is their political ties, is their political endorsements. And so so it's kind of like they're before, and actually before you would have members of a union be able to organize, mobilize, and come together around shared values around the workplace, workplace safety, and all of these things that were um, collective needs, despite whether you were who you were voting for, who you were like it didn't matter whether you're Republican, Democrat, whatever. It's like, hey, no, we are all workers and in this together. And right now, these unions have decided to politically align with certain candidates, and we've seen it. California Nurses Association, Bernie, huge Bernie endorsement. As soon as Bernie dropped out of the race, next day they're endorsing Biden Harris. And I was like, wait a minute here. Like,
Mhm.
I personally, me as somebody who is politically engaged and cares about these things, I was like, yes, I see the importance of supporting in this way. And I also see how it's dividing us as members, because nurses would be like,
So much
they
focus
would
on
literally be like, they would literally tell me like, fuck CNA. They just like endorsed Biden, and I'm not voting for Biden. And like, I don't trust now. What are the intentions with this union? Like, what is it?
Because Biden doesn't even support unions.
Well, but all that to say is that, like, what does it say about any company and their intentions? And when they politically align themselves, especially in a time where everything is already so polarized, it's like we really should be getting away from these identity politics, and coming together around the issues, like Rishi, like you have right here, these issues. We should be coming together around issues. And so I've seen the problems that this has caused, and nurses are like, no, I don't trust the union.
So what's a way, like, I mean, obviously for us, it's important not just to create some platform that would support a union of nurses, whether it's like with the union or they create a new union. But also at the same time, it's like, how can this also deal with that issue of being a citizen, right? Because at the end of the day, the reason the nurses union is doing that is because politics is what gets things done or doesn't get things done, right? And so would it be helpful for there to be a place for nurses to discuss the politics, including the politics of their community, the public health? Can they have a say in the local public health, right? I mean, I feel like if a nurse showed up at the city hall meetings, I'd be listening to the nurse's perspective.
Yeah, totally.
But we don't really get nurses showing up at city hall meetings.
I mean, and there was, when we do have these meetings, because a lot of these activists, like these nurse activists that have been doing it for many years are active in their local communities, there were those conversations and opportunities to be like, hey, this is what's happening with this in the city council. These are the actions going on. So, but if you weren't showing up in that space, you didn't know. And if you weren't, and even if you knew, that doesn't mean that you're going to show up and like, where's the incentive for people, young people, especially right now. But I do think that this is a way, yeah, a platform like this where we could discuss like local issues and how we can organize nurses together. Rather, it's just, so it's not just one nurse coming, it's like 10, 15, 20 nurses showing up at the city council meeting to say like, this is a problem. Because I know I showed up at my city council meeting to talk about concerns around public health policies that they were implementing that were disrupting our ability to gather at parks, local parks, which and things that didn't make sense. And I was voicing these concerns as a nurse that was working in the community, and I totally got like ignored, like. But if there were a bunch of us showing up, for sure, yeah, it would, of course, it'd be better.
And
maybe they would listen.
I was trying to research nurses union, and I ended up on their Twitter, on their website, and it just seems like very one directional. It's either they're kind of praising themselves and what they did right, or just showing that there isn't actually any discussion of the issues from the website. There's like no commenting on the website.
The website sucks for sure. Are you on which one are you on? NNU?
National Nurses United.org in this one, yeah, because they wrote about the Kaiser protest. But even with the Kaiser protest, like 3 days ago, 21,000 nurses are protesting, yet there's not on their Twitter, on their Twitter, there's 0 comments, and there's 100,000 nurses in the union, and there's 0 comments on that. And then on their website, it's just like a blog post, press release, no comment. Like,
yeah, there's no space to engage. In fact, I've like gone on there looking for information about stuff that like hot off the press stuff that I know is happening with unions, like, or voting for strikes. Like recently, Kaiser just took a vote to potentially strike next week. And like you can't find any of this information. Like they're so behind. And then there's also no way to follow up, like you said, or like if you like even the nurses strike that happened in September, there was 15,000 nurses that went on strike in Minnesota. And it's like, okay, well, what's going on with that? Like, did they settle a contract? Did they, like, where's the up to date, like, live information of what's happening across the country? And if we had a platform that was like, okay, let's figure where we had live hot off the press stuff nationally, and then we can break it down to
and
like,
it's
location.
Kind of making me think the same thing I always think is, yeah, there's like union reps and employees and stuff, but there's so many citizens who have the will to help, but yet no channels to participate and help. And there's so much like crowdsourcing information that could be gathered, and videos, and like there's probably 21,000 nurses. There must be like 5,000 people who videotaped it. So it's like, how could there be no news about it at all?
Or just like what like Clubhouse and all these things are showing is that we want to congregate and connect and talk about, like, we want to talk about things, but is there a space for us to do that?
Yeah, I know. And that was the media coverage was, like I shared before, was a huge issue. And also the getting the information to the community about what was going on with our experience. It was like, okay, again, flyers. Let's hand out flyers in the front. It's like, there's got to be a better way to engage our local community, to let them know, like, this is what we're dealing with. Take, for example, the issues that I was bringing up around COVID. When we were outside with those actions, it was like, I was like, how do we engage our community better? How do we let them know, like, this is what's going on, and have a conversation about it, rather than them just driving by and them honking because we have a sign up, or handing out a flyer? It's like, it's not effective,
Yeah.
Because
Yeah.
people want to help, like people do. When I was sharing this with people and actually having conversations, they were like, how can I help? And it's kind of like, and then I have nowhere to point them to. Like I don't have nothing tangible to send them to anyway. So
Mhm.
it's almost like having that next step as well. It's like, okay, how to engage people, and then what's the action, the call to action? Like, where can I send them? Where can we send them to help directly? Whether it's, um, using their network, their media coverage, whatever. Who knows, right? Like
Yeah.
supporting with a meal. Like if we're out there, on the street, like maybe that someone could donate some food. Maybe it could be fun. Like
Mhm.
that's, again, it's just there's a huge gap in what's the experience and then what the community hears about it.
Yeah.
Do
Yeah,
you
that's
Yeah.
do you like and also like on the other side of it, like what, like we obviously, I'm
Oh, that
taking.
looks cool. I like that what you're creating there.
Oh, thanks.
Mhm.
And so, like right here, I'm kind of like adding like stuff, like what are some like creative ideas that are coming to you, like, that would facilitate younger nurses engaging? What would, like what are different
I
things
would
that would
say
be.
some incentivization to be involved. Like whether it's again, like I was saying, and maybe that's kind of how it starts, and like to get people in, and because none of the stuff is paid, like we said, like, and people are already exhausted and you're working 12, 16 hours at the hospital. Like it takes a lot of brain power, physical energy, and just bandwidth all together to show up and to be passionate about these things. So maybe there's some sort of incentive way, like,
Like what are you imagining, like let's say there is a video that comes out, or okay, how about this, how about like if a nurse, she's just joining the union, and she's just starting at UCSF Children's Hospital, and she's just starting, and she gets pinged, like the whole union gets pinged, like all the other nurses. And if the nurses send her like a video or a recording being like, congratulations, if you need this, if they just anything, just
yeah,
invite, they get some coins, they get some like nurse coins,
yeah, they can get some nurse coins, and
like
maybe they
experience points, like
yeah.
if they engage with a new person, or just engage with the platform, they get points. Would that be good?
Sure, yeah. And I even think like it doesn't even have to be, I love that. And I think just the idea of them feeling supported, like in a community that they now have access to, in a like where they can engage regularly, is also a win, because you kind of get thrown in and you don't really know like where your resources are, who you can reach out to for help. So I think like something tangible like that, in addition to really driving home the message of like, we are here for you. Like, I mean, outside of union stuff, like community, um, how can we be like some sort of mentorship, maybe? I don't know. Like,
yeah. So you mentioned that you had a mentor. How did you meet your mentor?
it would just, it's something, we worked together on the same unit, we became friends, and it happened very organically. I think like him through him getting to know me, he was able to very quickly see like, oh wow, okay, I could see that she cares about this stuff. And he was also very active in the union, so he invited me to come to the meetings with him. And then I started joining, and so I started joining the meetings, and then he started inviting me in to sit on like disciplinary meetings with nurses, or kind of issues that he was taking on as the nurse rep in the unit or throughout the hospital. He just
Mhm.
started inviting me to kind of watch like what the process was like,
Mhm.
and it just happened very organically. Like I think that there's certain people who embody this mentorship role very naturally, and he's one of them. um and so, but we also but not most people aren't like that either, right? Like
Mhm.
I think it's important for us to have a space to learn how to become mentors too. And so through him is how I learned about all of this, and also became a mentor myself, so um
It kind of reminds me of something I just heard from my 15-year-old sister. So she's got a debate class in school. And I think that maybe younger people who experience this like division in politics right now are kind of more attuned to debating from like an educated perspective. Like she came home and was like, oh, actually I changed my mind on something. Like we
Cool.
were debating this issue and I thought I'd go one way, but then looking deeper into it, I actually did the opposite, which surprised her. And she came home like being like, wow, I'm like actually maybe interested in politics more now because I see how complex those issues are. So I hope that, and it's funny because I don't think like the older generation has many debating skills in that way. They have like authoritarian skills that are
Yeah.
not like, they're not ready to change their mind about stuff. So I'm
Yeah.
glad that younger generation has that skill in general. I wonder, you know, nurses being as educated as you guys are and how long it takes to like just even become a nurse. I wonder if there is that sense of like tools to talk about things without breaking into, you know, unuseful
Patterns.
yeah.
Yeah, I mean,
Yeah.
also,
Oh.
I wonder in that sense too, do you guys have to do, like, does CNA, like your nurses associate, the nurses union, or like, do nurses have to do education stuff? Do you have to take classes to learn how to communicate and debate?
Oh.
You have patient stuff, like, do you guys have
Do
all
not
those
yell
things?
at patients. Yeah.
How to not yell at patients. So what is required is, you know, for your license, you have to have a certain amount of continuing education units every 2 years, right? What those are in is totally up to you. So no, you're not required to learn how to not like, you know, nonviolent communication. You're not required how to handle, you know, difficult situations, whether it's around death, whether it's, I mean, some of those courses might exist, but yeah, it's not required. So one of the things that I was thinking even about this platform is that there are courses that are offered for continuing education, and unions like California Nurses Association, for example, they do offer continuing education already, and it's free for members. So for example, like I took courses in union stuff, like how to be like a nurse rep, like how to like, and I mean through these courses that they're like a day long or a couple days, you learn about the history of unions, like these certain laws that are you know, it's just the history and the laws and all this stuff, so you learn about stuff. And so it's really cool actually, like they had some really awesome stuff available. Now again, that was before pre-COVID, so that was like stuff was offered in person. So I'm sure now most of their stuff is online, but they have the ability to offer this continuing education because they have a provider number, which is required by the California Board of Nurses to get that, you know. So I do think there's an opportunity for education, and that's also a way to bring people in as part of that incentive as well, right? Like if, oh wow, if this is being offered and this is something I'm interested in, like I'll take it here, you know what I mean? Like I'll, and it's free if
Or
it's
like
being,
or like a retreat, right? Like if you're
yeah.
engaged on the platform, you can redeem those points for a retreat.
Oh wait, hold on one second, guys. I'll be right back. Continue without me for just a couple minutes.
Okay, so that's interesting. I didn't realize that nurses had to do continuing education and that some of those classes were offered. That's actually really cool. And I guess the union offers them. I wonder if there's any other resources that
Sure. I mean, on the other side of it too, like this is a way that the union could make money, right, from this platform, is that if any provider of these CEU courses, because that's usually what it is, like some educational provider, right, sells the CEU courses to the union, right? And so this is the platform could be like a marketing place for them, right? So that they can like let the community know of nurses, oh, hey, there's a CU course coming up about nonviolent communication. You know, who wants to take this course? It's going to be like $99, right? Something like that. So that can be like it can be a way for the CNA or the nurses union can actually make money by like advertising for these.
Yeah, I'm all for education integrated into this. Because yeah, a lot of a lot of stuff could use
Oh yeah.
more education.
And
Even for contract breakdowns.
Yeah, that whole totally. There should. I wrote that down here. Actually, laws and policy. I
Yep.
wrote down how to be a nurse rep, right? Like a
Yes, yeah,
class on how to be a
yeah.
nurse rep.
The retreat stuff is really interesting too, because these are things also that I again continue to bring up. Like, hey, why aren't we talking about nurses being exhausted and moral injury and compassion fatigue and burnout? And there was a lot of resistance that I received. It's like, oh no, that's woo woo, like, you know. And it's like, okay, well, clearly what this approach whatever's being done isn't working. Nurses are still leaving, you know, the industry in droves, like a lot. And so how do we address that piece? Because that's also a huge part of, like if we go to the why, the question of why is this happening? There are many answers to that, but it's not being addressed, right? Even with the union. So how do we create a platform that allows for nurses who might be more interested in retreats, might be more interested in self-development stuff, they can still be engaged, you know, in this union in a different way. Like, it doesn't have to be this hard line, like, activist, you know. I mean, there's so many, we're a spectrum of humans, right? So how do we engage the most people? We have to appeal to them in a certain way. And so, you know, I'm curious about like what that would look like, you know, mental health. Yeah.
What are those things called where you're like when you find people you like who also you can commiserate with, and it's like a group, like a, remember like Fight Club was about that?
Trauma
Like
bonding.
trauma bonding, right?
Yeah.
Like,
That's how I found some of my best friends in
right?
life.
Nice. Yeah. I mean, and
Yeah.
that happens naturally already in nursing. I mean, that's a big problem. Like, we don't have more spaces like outside of the hospital to talk about and really process these things that we're going through and seeing. um so yeah, trauma.
I also find that's like when I think about Clubhouse and why it was so it's been so powerful and so it was so alluring to so many people. It was a place for people to share their trauma, and you could see the groups that were forming in it are people's literally they're forming because people are connecting with other people who are experiencing something similar, you know.
Yeah, yeah, yeah. I like the idea of kind of a Clubhouse part of this tech, you know, where we can do these, and they're again nurse moderated discussions. It could be around anything from a trauma like death, like how to deal with death, to how to, like you said, how to be a nurse rep, or it could be just across the board, so many things. Love that.
Yeah.
But that's been the biggest thing, is just this like disengagement, you know. I saw over, I mean, and I was like, I really was I was even bringing people in, like my, because I had friends too that were used to be very active in the union, and I would ask them, like, why aren't you active? And even before I became a nurse, they were nurses longer, and I would ask them, like, why, you know, why aren't you come to the meetings anymore, like, or what happened, kind of thing, like, why? And it was simply it was kind of always about, like, it's not as accessible. Like, I have kids now, I can't really show up in this way all the time. I have or every time I go, like, I don't feel like I'm listened to. I don't feel like there's a space. So, you know.
There's something that it reminds me of too, is like, how many hours have you actually spent on it? Like, how many unpaid free hours you spent on it? Just tracking that and just showing that, hey, look, through those meetings, we've invested 100 hours of our time to discussing those issues. Like, that puts it in perspective of achieving something, instead of just being there and not being recognized. Like, just putting a little bit of like a timer on it, and then pooling everybody's hours together for this cause, usually gives a certain feeling of satisfaction, at least, or recognition that you've spent that time that, you know, maybe isn't being recognized right now. Just noting that,
Yeah,
might
and maybe Paulina, what if once you reach 100 hours, then you
Mm,
get something, right? Like it's so
yeah,
it's again,
exactly.
if we tie it to some sort of incentive model, or like you get, 10, you get like, 30 units for free or something like that, which would cover your
Yeah,
education for 2 years. So like that, I mean, and that costs nothing to like $1 billion corporation. Like, I mean,
yeah.
and also like you said, the transparency about like where are the member dues going, like where is like creating transparency around that. But I do really love that, like quantifying, like being able to really quantify like the hours that you've put in, see it somewhere, and be like, okay, and I've invested this much time, and what has anything changed? Now you can really kind of assess,
Hmm.
like, has the investment,
Hmm.
has anything fruit, like has there been any fruit from that investment of time,
Yeah,
if not, like what do
absolutely.
we have to change?
And it's actually, I realized while we were building democracy, is one of the ways to build trust is show day after day that you're showing up. Because otherwise, somebody comes to see you for the first time, a nurse joins, she has no idea what you did before or what those meetings are for. But if there was a little bit of a record of like, look, this person has been there for 30 years, without having to prove it to them in person, there'd be a certain amount of trust and respect that automatically is you
Mm-hmm.
know obvious, just
Yeah,
because of that historical account of what people participated. So maybe that would
maybe
give a
that's
little
like on
bit.
the personal profile or something, right? Like if like those are being counted by the program, and then people have it on their profile that's like visible to everyone.
Or and there could be like cool like features, like I'm thinking about like gamifying it, right? Like you get like rewards or badges, and we had that
Mhm.
already, right, Paulina, with the badges. But maybe one of the badges, it being like your, let's say you're like your mentor, right? What if like 5 nurses recommended that person to be a mentor badge, right? And so
Uh-huh.
they get
Oh,
a mentor
cool.
badge, so that because they've been verified by community members.
Mhm.
Or even like I think also like bargaining team member is a really good mentor, or not mentor, is a really good badge to have, because like to show that you went through that process like says a lot
Yeah, definitely.
about your grit.
Who's the well-being badge? Like which nurses are like
Yeah.
meditation teachers and whatever
Yeah.
yogis, right?
Totally. Totally. I love that.
Great. Yeah, I think that's something I keep hearing over and over again, is like, I volunteered all those hours. If I could just have a
Well,
note.
you know why, Paulina? Because we're not being recognized or acknowledged in any of our workspaces.
Mhm.
I mean, especially nursing. I mean, there was a recent survey or poll or something that I saw that was like that was one of the biggest points of I guess contention with like with how nurses were feeling in the workplaces, like lacking acknowledgement for what they're doing and how they're showing up every day. And so this is very well known. I mean, they talk about this in managers say it all the time, and like, oh, how can we acknowledge you better, and this and that, or like, and it's like, it's so simple to me, but at the same time, like they don't understand it. So if we can give that to each other, we we don't need them to do it for us. but
Yeah.
that's but that's huge. So like you said, for it to be noted, acknowledged, like this is how much time this person has put in, um because that's what we're all really seeking anyway, right?
Yeah. Yeah, that's great. I can see that being a feature for sure, especially when the task needs to be done too. Like, kind of, sometimes the people talking the loudest are the ones that are inputting the most time into it. So,
Yeah, right, most of the time.
and I'm not gonna out yell anybody anytime, because that's just not how some people are. So
Me neither.
yeah, no yelling here.
No yelling.
um
But even if there's a way, yeah, like if somebody volunteers to respond to a question, and then maybe even if they then take it a step further to consult with you know, the actual union themselves, or like if they go kind of above and beyond, there's a way to make note of that, where like they took the extra step, or I mean, even just responding, right? Like if they're responding to someone, that should be acknowledged, right?
Yeah, definitely. And I mean, if I had a question and I had somebody helping me, I'd right away feel more thankful and engaged instead of ignored. And you know,
Yeah. Yeah.
so that's great.
Yeah.
Yeah, maybe this is also something in communicating this to like a nurse union, that like, hey, this might be a way for y'all to save money and time and energy, because maybe you don't need some of the labor reps you have, and or maybe you don't need some of the admin that you have, and this could be your not just your communication tool, but also as documented information about the needs of the community, you know, and their
Yeah, and
No,
I
no,
think, oh, go ahead, Polina.
it's like, you know, the union started because people binding together gives it more weight. If you have 1,000 people saying, yes, I want that, that issue has more weight. So it's like there kind of needs to be that binding within. The union is already bound within that to come up with the issues that the union is addressing. It'd have more weight if there was more community behind it.
Yeah, and if we actually go back to like, you know, the history of unions, really, it really was about just people wanting to control their workflow, right? And to be acknowledged, to be able to feed their families and be taken care of, basic stuff, right? And so really getting rid of the middleman, I think, is a huge part of the direction.
middle people.
Sorry, the middle beings, I guess. I don't know if they're people, but getting rid of the middle administration, and middle management, that really all of these corporate structures have become so dependent on, so that the ones at the top don't have to deal with with the actual people. um we need to, if we could start shifting towards that, so that I mean, that would just by nature create more transparency. That would eliminate so many issues just within itself, you know, by shifting towards that, because there's so many they're just like the gatekeepers, is what it seems like, you know. So
That's democracy. Sound like a little
yeah.
bit.
Cool. So
Yeah, yeah.
I feel pretty complete. Like, how do you guys feel? Any other questions? Any other things? Any last comments?
Well, I think what I take away from it is that there's a few features that are like defining in my mind, and I can kind of like start seeing the buttons and lists that need to happen to make it happen. So I'd love to have some time to mock something up, play around with it, and just keep talking about it and keep coming back to it with more and more clarity, and like zeroing in on, you know, the execution of it. Because what I'm interested in the most is the product that could be helpful, free, open, evolving, built by volunteers for volunteers. So that I feel pretty inspired from this meeting to envision and really bring to life. So that's what, and thank you guys, because I didn't know any of that stuff about the nurses at all. That's so educating.
Yeah, thank you guys for inviting me in to share, because I think it is a a unique perspective, and I think it's inspiring also for me to hear that you know, you putting that stuff up visually, Rishi and Polina, you talking about how you can see things, because these are all things that I've been inspired by as well. And then, you know, when you continue to get shut down, it's kind of like, wah, wah, you know, okay. But now it's like, okay, it's possible. We can do this. You know, we have to continue to keep having these conversations. So, and building it.
Yes, and I'm all about hello nurse. So whenever there's a nurse, it's like hello nurse.
Thank you, nurses.
Thank you, nurses. Thank you. That's what I mean
thank
by
you,
that. That's what I mean
thank
by
you, nurses. Thank you, nurses.
that. Thank you, guys. Thank you, Paulina.
Yeah.
Thank you.
Thank you all.
Thanks.